So let's check this out. Heart disease, a very serious ailment. It is hurting a lot of people. And here's just some single facts about it. Over 600,000 people die of heart disease in the United States every year. And that number may have gone up. So when you think about it, that's 1 out of every 4 deaths is someone from a heart disease. And just last week, I was at a funeral of a dear friend had a heart attack. So heart disease is prevalent. You can tell by those numbers. 1 out of 4 people who die of heart disease. Now, heart disease is the leading cause of death for both men and women. So it leads the list. I mean, sometimes people like to say accidents will or something else, but here it's saying heart disease is the leading cause of death for both men and women. More than half of the deaths due to heart disease in 2009 were in men. Now, coronary heart disease is the most common type of heart disease. It's killing more than 385,000 people on an annual basis. And now this might be back from 2010 or so, but these numbers continue from year to year. They either get better or worse. And the way the country is set up is probably getting worse. Now, every year, about 715,000 Americans have a heart attack. And of these, 525,000 are first heart attack, and 190,000 happen in people who have already had a heart attack. And usually that second one might be fatal, like it was for my friend that just passed away. So this thing is a very serious thing. And I'm going to read from a book from one of my colleagues and doctors that I listen to a lot to tell what people need to do about this. Now, coronary heart disease alone costs the United States $109.9 billion. That's what it be every single year. So the total includes the cost of healthcare services, medications, and loss of productivity. So that's a large amount of money. If somebody gave me $108.9 billion right now, I could live to 199 and couldn't spend it all. So that's a huge amount of money. And these are just some basic facts about heart disease. So what I want to do is now go into this book by Dr. Joel D. Wallach. It's called Dead Doctors Don't Lie, pretty popular book, and read about what he has in here about heart disease. And it's part of the cardiovascular disease family. And Dr. Wallach says prevention is the name of the game when it comes to heart disease. Good nutrition means moderation in all things, with no fried foods, no processed meats, and the baseline nutritional supplements are best. Now, you may be familiar with longevity-products.org. There are thousands of longevity associates and distributors. You can buy these products from any one of them. Now, pay special attention to making sure you get EFAs, which are essential fatty acids, and avoid as much of the saturated fatty acids as you can. Other than the essentials such as flaxseed oil or fish oil. Now, pay special attention to getting selenium at least 500 mcgs per day and vitamin E. And then you want to exercise in moderation. A 30-minute walk, is a good idea. I always tell people that don't exercise at all. Start by just making sure you get out, take a walk, get the kids, get the grandkids, get the wife, husband, and just go on out for a stroll. These days, if you can't get anybody to walk with you, go buy an iPod and put these audios on there and just listen to inspirational or self-help type of things so that you get these things into your mind. Continuing on in Doc's book, it says more exercise in moderation. Walking in the evening is good. Avoid vitamin D as an adult. More than 400 international units per day results in the calcification of coronary arteries and the target tissue for vitamin D poisoning. Now, keep 30-minute oxygen tank in your house. This is if you've had a heart attack or a problem. And a 2-hour supply if you live in a rural area. Definitely learn CPR and have a nitroglycerin capsule or transdermal nitroglycerin patch on hand. Obtain an IV infusion set and several 500 ml bottles of lactated ringers to set up the IV should a heart attack occur. So this is, of course, he's reading towards people who have put themselves in this predicament where they are definitely going to have problems with. They already have problems. Now, don't regulate your survival to an EMT who might or might not know and might not get there on time. Learn as much about emergency heart care as you can and keep them in your home because unpreparedness will kill you. Now, treatment, once you have had a heart attack, You may need as many as 2 chelations per day, 80 or more days to ensure full recovery for your heart. Be aggressive. EDTA chelation is what he's talking about, H2O2 added. Now, your orthodox cardiologist will not agree to this, so you will have to arrange it yourself. Increase your selenium intake to about 1,000 mcgs per day, and your vitamin E to 1,200 to 2,000 international units per day. And take 5 to 10 alfalfa tablets with each meal in addition to the baseline nutritional program. Then you also want to take 2 ounces of an oxygen supplement in the morning when you awake and 2 ounces before retiring. Take the betaine HCl or AC1 and pancreatic enzymes at 75 to 200 milligrams before meals. Refer to your physician's desk reference before taking any medication your orthodox cardiologist wants to prescribe for you. Don't take any medication you do not fully understand. Remember, 40% of all patients are in the hospital because of a iatrogenic disease, doctor mistakes in medical medication or surgery. So get back into your walking and or swimming program as soon as you can and get on the nutritional supplements. Now, excuse me, you can look over at our website, longevityproducts.org. Longevity altogether has a product called the Heart and Brain Pack. And so all the things he was mentioning there as far as supplements are in that package. If you have any kind of heart problems and you want to fix these, the first thing you need to do is lay off of meat. Meat should be about 10 to 15% of your diet. I would also stop eating anything fried, and I would also stop eating wheat products. Not that this has anything to do with your gluten, but it helps with digestion. And right now you need these supplements to really get through your small intestines and into your bloodstream to help fix those blood arteries in your heart, so that this heart condition that you may have or a loved one may have can get eradicated. So I want you to get on the Mineral Man newsletter and go to themineralman.com, and we got videos of Dr. Wallach on there out the wazoo. Educate yourself, not just Dr. Wallach, Dr. Davis, a lot of different doctors who are finally opening up, MDs, not just naturopaths. MDs are finally opening up to the fact that their education, not them, their education of helping people is what's killing people. People are not living long. They're having all these diseases. And so it's taking some people to wake up, see all of this, so that we can help the next generation. So that's facts about heart disease. That's what you need to do to get over them, and you will be just fine if you follow these. Start walking, start mildly swimming, and for about 30 minutes a day. And get these supplements into your system. Stop eating wheat, heavy meats, and processed meats, and fried anything. I don't even want you to fry. I don't want you to even look at a French fry. So that's it today. I'm Duke Daniels, and I hope this resonates and hope it helps somebody, because otherwise, the body's, it's like it's science. It's going to kill you if you don't. So take care. TheMineralMan.com. Get on that newsletter and get on. And if you need products, if you just want products, you can go to GetYourMinerals.com, and you can buy the Heart and Brain Pack. Become a preferred customer. It gives you a 30% discount rather than buying wholesale, and you will see improvements. We are here for you to contact us if you have any questions. God bless.